Good morning, everybody. Oh, wow. That's a little louder than I anticipated, but that's good because I have a hard time speaking loud. So today we're talking about skilled care and short-term rehab. I'm Lindsay Camden, and I'm the admissions and discharge coordinator for the rehab unit. So we're going to talk about what short-term rehab is, which is if you come for short-term rehab, you're going to get specialized therapy provided to people that are recovering from illness and injury post-surgery or any other event that you might have. It's delivered by licensed professionals such as physical therapists, occupational therapists, speech language pathologists, and its focus is to help you regain your abilities and independence so that you can return to your prior level of functioning, hopefully. Again, the goal is to reach your highest level of functional ability, but it's important to note that your highest level of ability may be different than post-surgery or post the illness that you're recovering from. So during your stay on rehab, which would be on 6 Harside, you're going to be followed by our medical team. The physician is Dr. Lord, which probably a lot of you are already familiar with. And we also have a new nurse practitioner, Jennifer Shuddy, that will be starting with us. You're also going to get therapy provided by our physical and occupational and speech therapists as ordered by the medical director. And you'll also be receiving specialized nursing care specific to whatever's going on with you at the time. So how would your stay be paid for? Typically, if you've had a 3-night hospitalization and you have traditional Medicare, Medicare is going to cover your stay. Medicare covers the first 20 days at 100%. Days 21 through 100, there's typically a coinsurance. If you have a secondary insurance, that should pick up that cost. The coverage is different if you have a managed care insurance company as well. But typically you have a 100-day benefit period. That doesn't mean that you would be in rehab for 100 days. It really just depends on how long you're meeting the requirements for us to be able to keep working with you. Again, I'm Lindsay, so you can contact me if you have an upcoming surgery to let me know that you in a month might need a room, and I will pre-book and hold a room for you so that we make sure we can take care of your needs when you have an upcoming surgery. So you can call my extension at 3402 to let me know what's going on. So there are different options for you all. For 6 Harside, you may need to come for what we consider a short-term care stay or a short-term rehab stay, and I'm going to try and explain the difference. So we are looking at a couple. There's Joe and Jane who live in independent living. Joe needs help with bathing, dressing, and toileting, and Jane is able to help him with those needs when she's at home. Jane is getting ready for a hip replacement or another issue that causes hospitalization. With Jane in the hospital, Joe doesn't have anyone to care for him at home. So Joe would come to Hearthside for what we call a short-term care stay. And that's just so our staff can help him with routine care needs because no one's there to help him at home. He hasn't had a hospitalization, so Medicare's not going to cover that stay. And typically, depending on your contract, it'll be covered in your contract, or you may have a daily fee associated. That's something y'all could talk to Melinda about your coverage. The goal for him would be to return to independent living once Jane's able to return home and she's able to help him. Now, Jane needs to get better from whatever's occurred to her, whether it's a hip replacement. So she's going to have a 3-night hospitalization, which makes it so Medicare will cover her stay on the rehab unit. Medicare will pay days 1 through 20 at 100%. On day 21, there's a copayment of $194.50 a day that she will pay. That's only if she didn't have a secondary. But once she goes home and she's at a level where she can take care of Joe, both of them would return to independent living. So what are some things that you all can do You're going to want to ensure that your insurance is in good standing. Also, we have open enrollment coming available for Medicare, so you might want to talk about your options if you're in a managed care program. You'll also want to notify us again of any upcoming surgeries that you may have so that we can ensure that we have availability for you. Also, when you're in the hospital, notify your doctor that you're a Westminster resident. What do we do? We'll take care of everything else. We will let the hospital know when we're notified that one of you are admitted to the hospital. We call the hospital as well and notify them that you are there so that we can follow you during your stay. We will check your insurance and your benefits so that we can discuss that with you, and we'll make sure that a room's available for you when you're ready for discharge. So what are some things that you can bring with you to the rehab stay? We're going to provide all the furnishings, so you'll have a bed, a bedside table, a lamp, dresser, television. We provide a phone, Wi-Fi, and recliner. You should bring things to make you more comfortable, clothes, walking shoes, things for you to be able to do your rehab sessions in, personal hygiene items of your choice, and your cell phone, tablet. You're welcome to bring those things. Again, let us know if you have upcoming hospitalizations that you're already aware of. You can contact me, and then how long can you anticipate on being there? It really depends. Everybody's stay is going to be different, but on average, it's about 2 to 4 weeks. We work together as a team to get you home as soon as possible with any follow-up services as needed, often home health therapy or outpatient, whatever's recommended. And then I will help you get home. So, do any of y'all have any questions? Yes. So her question was, how many times per week would you need therapy for Medicare to pay for it? Javier is letting me know that it's 5 days a week. And you had a question, ma'am? Okay, so her question was, do you bring your own medications for rehab, or do we use ours? When you're on the 6th floor, we have to provide the medication, so we will order them from pharmacy. We can't have you bring your own medications. Yes, sir. I'm going to let Ashley take that question in just a second, but he asked if the nurse practitioner was the same in the clinic. Did anybody have any other questions for me before we move on? All right, thank y'all.
Hello, good morning. And we can finish more questions once we get through everything, because there'll probably be questions for all of us. The question about the nurse practitioner, I was going to talk about that as soon as I came up here. Her name is Jennifer. We just hired her recently. Well, Dr. Lord just hired her recently, and I just sent out last week for them to post it in your weekly. So it should be, I don't know if it's in there this week or the next week, so you guys should be seeing that with a little bio about her. And Jennifer will be in the resident clinic and assisted living, and she'll be just doing exactly what Angel was doing. So yes, we're excited for her to come. She's very nice. So let's talk about your skilled care nursing, the nursing piece of it. So what is nursing? So you need therapy or you need nursing services followed by an accident or incident. Your nurses are going to be a big part of your recovery. We have RNs, we have LPNs, and we have certified nursing assistants that are going to oversee your care. Someone will be there to help you at all times. All you got to do is ring your call bell, and someone's going to come in your room. Give us a minute. Sometimes it does take a few minutes. There are a lot of people on the unit, but we will be there to help you. And we do use a person-directed approach for your therapy, so we try and individualize things based on something that you like. If you're someone who likes to sleep in the morning, we're going to try and let you sleep in as much as Javier will let us, because, you know, his therapy is very important while you're there. So staffing as far as nursing goes, we have a continuity of care, which we try and do consistent caregivers. That doesn't mean that you're going to always have the same CNA and the same nurse, but we do have certain ones that work on that floor every day, and they're on 2 separate teams Now, there are vacations, there are different things that happen, but you're very consistently going to have the same 2 nurses on day shift, 2 nurses on night shift, and then the CNAs as well. We have 12-hour shifts, and then, of course, we have some part-time and limbo staff that'll fill in. Our CNAs are going to assist you with your activities of daily living, your bathing, your oral care needs, your transfers, and your meals. And then your charge nurse or medication nurse is going to assist you with any medical concerns and giving you your medications. There is an RN manager on duty at all times, so they float around to all 5 of the healthcare units. So there's always an RN there at all times. And we are going to provide your pharmacy needs, your labs, and any radiology services that you may need. For pharmacy is not on site. We do receive our medications from a pharmacy outside of here. But when you come to us, your medications are going to be reviewed, and then we'll order them and then give them to you from the floor. They cannot be kept in your room or brought from home, and that is a safety thing. Being kept in your room is a safety thing. You never know that your neighbor might be someone who's confused, and we wouldn't want them to come into your room while you're in therapy and accidentally take something they shouldn't take. That's just a safety measure. The medications have to be in certain cards for state regulations, which is why we have to order them from the pharmacy. And then all medications must have a doctor's order. So what to expect? You can expect to get medical care and attention that you need. You can expect a care plan meeting that is just for you, which that meeting will have Lindsay in it. It will have Javier or the therapist that's working for you. It'll have your nurse in it. And those meetings are just every couple of weeks to kind of talk about how you're doing, what anything that we need to do differently, or if there's something maybe we're talking about discharge already. We're starting to plan your discharge process. You'll be able to see the physician and the nurse practitioner when you need to, and you'll see the nurses and the CNAs every day. They will be there constantly. You'll be treated with respect in your home and good food. Also, planning your care and setting goals with staff is going to happen in the first few days of your care, especially with therapy. They're going to start planning, all right, what are your goals? Could you take the steps when you were in independent living? Is that something we're going to be looking at? And how long your stay is going to depend on the care that you need based on the therapy that you're doing. Visitors are welcome. Pets are allowed. So what do you want to bring? Bring about 3 to 5 sets of clothes that are easy to get on, easy to get off. Especially if you had like a hip or a knee replacement, you want something that you can get on and off easy. You know, those fancy dresses that you're going to wear to the Halloween party or the blue dots. I heard about y'all. Those T-shirts might be okay, but definitely comfortable clothes. You can bring a pillow or a blanket if you want to, if it's something that's more comfortable for you. We also provide all of that. Bring your cell phone, your glasses, hearing aids. You want to make sure you can hear Javier when he's trying to make you walk up and down the hallway. You can bring your insurance card if you want to, but you guys really don't need to just because you are already living here, and Melinda has all that stuff in the system for us. If you have a copy of your power of attorney and that's something that we don't already have, that would be important for us to have. And anything else that makes you feel at home. And what not to bring. Don't bring medicine, don't bring a bunch of cash, don't bring valuables, jewelry, clothing that is hard to laundry. We don't want anything that needs to be dry cleaned, and furniture. You don't need to bring any furniture with you. We've got all that stuff. So the day of your arrival is going to be really busy. Just know that the first day you're exhausted from the hospital. We get that. We're going to try and do your admission as quick as possible, but we are going to get a list of your medications from the hospital, and we'll start putting those in before you get there. We'll discuss your wishes when you get there, and then the nursing assessment is kind of the biggest part. As soon as you come in, nursing has to do a full body assessment on you. They got to look at your skin, make sure that if you have anything, you got any bruises or anything, the hospital did them to you. We're not claiming those. You know, we want to make sure all that stuff's documented. Most of your medications won't be ready as soon as you walk in the building, but they should be on the way from the pharmacy. It depends on how fast the hospital gets us the orders in the morning. And then it may take a little time to adjust to your stay, but new staff, new routine, but I promise we're very good at it. And a few of these are just our day shift staff on Six Hearthside. If any of you have ever been to Six Hearthside, I'm sure you've seen Tia or Kiana. They're day shift charge nurses, and they've been with us for a long time. And then the aides are with them. So these are just the day shift ones I thought I'd show you. All right, we'll go to Javier, and then we'll save the questions for the end because he might answer some things that way.
Good morning. Thank you for coming. Can everybody hear me? Last time there was a little difficulty with me getting away from the microphone, so if I do, just raise your hand. My name is Javier Acosta. I'm the administrator. My name is Javier Acosta. I am the administrator for physical therapy. I manage the outpatient as well as skilled. Can you hear me now? Good. Can I rip this off and just hold it like this? Okay, so let me tell you the difference between your rehab and outpatient. So rehab is pretty much a 5 to 6 day period. You're going to have physical therapy, occupational therapy, and speech if needed. So we're going to go back to what Ashley was saying. The first day you come in, you're going to be processed with everything. We'll see you within the 24-hour period after that. So they'll do the physical therapy evaluation, the occupational therapy evaluation, and the speech evaluation. At that time, the physical therapist will sit down, talk to you about what your needs are, discuss your diagnosis with you, and then what the process is going to be. So PT, so let's talk about that for a second. The difference between physical therapy and occupational therapy. Physical therapy normally works on strength, range of motion, and mobility. Occupational therapy normally works on ADLs, that's dressing, bathing, going to the bathroom, managing your pills if you need to at home, and also with upper extremity stuff, range of motion, those kind of things, getting out of bed. Now, between both therapies, there is always crossover. So physical therapy will work on balance as well as occupational therapy because there'll be certain things you'll be doing in the bathroom or in the kitchen with occupational therapy, but there'll be certain things you'll be doing with physical therapy that require the same kind of activities. Speech therapy. Speech therapy just doesn't work on speech. It works on cognition, especially after you come from the hospital and you have a high dose of medication because of pain. Your ability to sustain memory is going to be a little difficult. So she has certain drills that'll help pull that stuff out of you and help. It seems like it's going to irritate you a little bit because it is. When your brain is a little foggy, to get your body, your synapses to start firing, they need to ask you difficult questions to get that data out. As you start getting better, that information comes a little smoother. But at the very beginning, it's going to be a little bit like that. So don't be concerned with it because it's just the process of your healing body. It's a 5-day stay or a 6-day stay. So how do we determine that? When they do the evaluation, if you're a joint, total knee, total hip, you're going to be here roughly, you're going to be working 6 days a week. So you'll be having physical therapy and occupational therapy Monday through Fridays, twice a day. And on Saturdays, it'll be physical therapy only. If it's just a standard, say balance and stuff like that, the therapy is only going to be 5 days a week. But you're still going to have 2 therapies a day. Therapies last roughly about an hour. So a lot of times you're thinking, gosh, an hour is a really long period of time. I'm going to have 2 hours of therapy a day. That's 10 hours a week. Some people can't handle that. So we'll go back numerous times to see you. Sometimes we'll break it up into 15-minute increments. Sometimes we break it up into 30-minute increments. It just depends on what you're able to sustain. Like Lindsay was saying, it is a short stay facility. So we try to move you along as quickly as possible. I'm going to use an example. If you're a total knee, we only have a period of time to get that knee moving again. Total knees are very painful. We try to administer as much pain on you as possible. I'm joking with that. Okay, but it does seem that way at times because your knee does not want to move. It's been surgically altered. So we need to bend you and move you. We're not trying to be sadistic, even though it might seem that way. But the reason why we need to implement that kind of motion to the knee is the knee will start scarring down as soon as you finish therapy, as soon as you finish your surgery. So we need to move you as quickly as possible. We try to get you back to your previous level of function as close as we can. Do we always achieve that? No, obviously not. Sometimes before your surgery, you didn't use a walker, but you get sent home with a walker. And the reason why is because you're going to be transitioning to a home health setting, so you'll have therapy continue there to help with the transition. They might achieve the part where you'll get off the walker. But most of the time, if you come in with the walker, you start with the walker here, you'll be out with the walker before you leave. So there'll be no problem with that. Is there any questions so far with physical therapy? Physical therapy for rehab is Part A Medicare. Outpatient is Part B Medicare. So Lindsay already went over the process of coverage for that. Is there any other questions at all? Nope. Well, thank you so much for coming. If you guys need me, my extension is 3483. You can call me in rehab, and I'll get back to you as soon as possible. Thank you. The next speaker will be Michelle Elliott. She's a dietitian.
Hello. Oh, here's a picture of the therapy team, if you all would like to see it. And that is me. All right, so tell me about the meals. So what I want to stress here is that you get to make your own food choices. So you get to make your own food choices when you're at home and when you go to the cafe, when you go to the James River Grill. And so we're going to allow you to still make your own food choices when you are staying with us. Having said that, we do have a set menu, like everywhere. However, there are times when maybe you don't like what we're serving, and that's okay. You can choose what's on there, but we always have an always available list, which I think they have in the cafe as well. So we always have sandwiches that we can give you. We always have a chicken breast, a hot dog, a hamburger, salmon, those types of things, so that you should be able to find something that you would like to eat if you don't like what we're offering on the menu. Usually for lunch we have a standard menu of, like, sometimes it's a sandwich and a soup. Sometimes it's a soup and an actual entree, a starch, and then a vegetable. For dinner, for the evening meal, we offer the 2 entrees, 2 vegetable choices, and then the starch and dessert. So you can eat your meals in your room if you'd like. We do offer you come out and join other folks in the dining room. And like I mentioned, we do have the always available food list, and then snacks are available pretty much whenever you would like one. So if you wake up in the middle of the night and you're hungry for something, within reason, the nurses can provide you typical snacks, like maybe make you a sandwich or offer you some ice cream or cookies or crackers or something like that. But yes, you can always get a snack that's available for you. Special diets if needed. So the biggest thing I'm seeing more often lately is food allergies, food intolerances, or some of it is just a preference too of you're choosing not to eat certain particular foods. But if you do have food allergies or food intolerances, please do let us know when you come so that we can try to accommodate and work with you with that. If we don't know, we can't try to assist you. We do our best. I'm seeing more and more people with alpha-gal, unfortunately, where you cannot have red meat, and then some of those folks can also not have dairy. So we try to work with you and trying to accommodate and offer you different alternatives if you cannot. The red meat's not so bad. We can provide you chicken and fish and other protein sources. The dairy one's a harder one. There's a lot of dairy and potentially in different things, the big items. But anyways, we'll do our best with the different food allergies. Some people have shellfish allergy. Just whatever allergy you have, we will try to do our best to work with you on that. We do accommodate diabetics in the sense of, I will say we are a liberalized facility, so we are not a strict diabetic regime up there. Actually anywhere in healthcare. You still get to make your food choices. So if you, while it's not recommended that you have maybe ice cream for every meal, if you chose to do that, you could. But the biggest thing that we offer is alternatives for you to choose. You can make your own lower carbohydrate choices if you choose to do so. The main thing that we do with our diets is offering you a sugar alternative instead of regular sugar. And then a dessert, we offer you a half portion of your dessert instead of a regular serving. So we're trying to help you cut back on your carbohydrates, but also letting you drive the bus so that you can, make your own carbohydrate choices. Maybe you're shooting for a certain amount of grams of carbohydrates per meal. You can choose that, whether that 15 grams that you had is going to be a piece of bread or whether it's going to be, a half cookie. So that's up to you. We're trying to let you still make your own food choices. We also offer, really the only other restricted diet we have is a no added salt, where we don't add much salt in cooking, but we also encourage you as the consumer not to add salt when you're eating the meal. We offer alternatives to salt. We offer different seasonings, pepper, Mrs. Dash, those types of things, so that you can still have flavorful food but not have all the salt. And then the last option that we have is mechanically altered diets. Say you unfortunately have a stroke. You come back from the hospital to us to rehab, and unfortunately a lot of times stroke affects your ability to swallow. If that is the case, first of all, you're assessed by the speech therapist, which is also the swallowing specialist. She assesses whether you are safe to swallow, what consistency is best for you. We do offer the 3 different consistencies. One is puree, and then the next step up is called our level 2 mechanically altered, where some foods are soft, and then some foods are still pureed if they're harder to chew or swallow. And then our level 3 is our diet that offers ground meats and softer foods. And then the next step is a regular diet where you can eat whatever you want to. Also, along with that, if you are having trouble swallowing, even if you didn't have a stroke or you have esophageal dysmotility or whatever your issue is, if you have a little bit more trouble swallowing, we do offer thickened liquids if that is recommended by the speech therapist. So our definitions of those are nectar thick and honey thick, which means nectar, if you can think of what, like nectar, the thickness of that, that's what the nectar is. And then honey, if you pour honey, it goes off the spoon slower, so that means it's thicker. So we offer those. They're prepackaged, so they already come that way. So those are an option if they're needed. Usually someone is on that, they had a stroke, and then as their swallowing progresses, the speech therapist gets you off of that usually, and you get to progress to regular thin liquids. But those are just the different consistency diet options that we offer if they're needed. So when you come, we do a nutrition assessment on you, and that really consists of, finding out if you have food allergies, what foods did you consume before, what's your usual body weight, have you lost weight, have you not, and then our main goal usually is we just want you to maintain your weight. Say you come to us and you're overweight. That is not the time when you're working with rehab and therapy as you're trying to get better from say a hip fracture. That is the time, that is not the time to be thinking, oh my goodness, I need to lose weight now. No. While you may need to lose weight, that is not the time. So usually when you come and you're working on therapy, we want you to eat enough so that you are strong enough that you can work with therapy. And then as you progress, and get better, then, after you go home, if you want to have your weight loss goal, we can assist you with those different guidelines and things. But usually in therapy, that's not the time if someone wanted to lose weight. Our main goal usually is we want to keep you at the same weight. Now, that's not to say that your weight won't go up after surgery from all the fluid and things, and your weight will come back down. But overall, we usually just want to maintain your weight. And then we do offer nutrition supplements. Sometimes after surgery, your appetite's just not as good, and sometimes people are willing to drink more than they're willing to eat. So sometimes we do offer things like Ensure, Boost, or Glucerna if you're diabetic, those types of things, so that you're still getting the nutrition even if you don't want to eat as much right now. And usually as your appetite increases, we can wean off the supplements. And usually people don't go home on nutrition supplements because they're usually back to eating normal like they were before their surgery. Any questions? Yes, ma'am. Yes. The question is, do we provide an alternative for nutrition supplements that do not contain dairy? Is that basically your question? Okay. Yes. Because we are seeing more and more folks with the alpha-gal or having a dairy intolerance, yes, we do have a alternate. It's called Kate Farms. I don't know if you've heard of that, but that is our alternate for those. It is dairy-free. Well, they're all lactose-free, but it's dairy-free, and it's actually, because most of the supplements are whey protein. And the Kate Farms is actually a pea protein. So you're still getting your protein, it's just, it's plant-based. It doesn't have, obviously, meat and is no dairy. So yes, we do accommodate that. Any other questions? Yes, ma'am. The question was if you are normally taking a multivitamin or any other vitamins like calcium or vitamin D or whatever. Yes, you can continue to take those. You cannot bring them from home. We have to provide those. But yes, we do encourage whatever you are usually on vitamin mineral wise to continue that after surgery. You just unfortunately can't provide your own. As Ashley kind of mentioned, even if it's over the counter at home, everything is pharmacy and physician given and prescribed when you're staying with us. Any other questions? This thing seems like it's going in and out. Okay. Okay. Yes. Okay.
So he was asking about how it works with Dr. Lord and Jennifer and the services up there. So Dr. Lord is here every Thursday all day, and then he's also here sometimes in the afternoons, and then he's sometimes here on the weekends. Jennifer would be here Monday, Tuesday, Wednesday, Friday, all during the day. So when you're admitted, the doctor will come in and do history and physical. He'll do a progress note. He will come and see every admission. Sometimes it'll be that afternoon. Sometimes it might be the next day. But he does come and see everyone. And then Jennifer and or him will do the recertifications, which are what are required for Medicare. And that's just something they have to do every so often that we keep them on track for to make sure that we're meeting requirements for Medicare and your stay and that everything is going to get paid for like it should. That somewhat answer your question? So he asked if he has any decision like directing your care when you're on the floor. So he definitely will be changing any medications. He'll be talking to us, and really the nursing staff are the ones that are like, hey, something's going on with their blood sugar today. Like, let's look at their blood sugars, and Dr. Lord will maybe change your insulin or do something like that. If you see a specialty doctor, like if you typically see a cardiologist, you will continue to go see your cardiologist. That's not something that we would take away from you at all. Dr. Lord is very big on if you have a specialty doctor, he wants you to continue seeing them because they know your care like that. And he gets all of your orders from the hospital. So the hospital is the one that's sending us all your stuff saying, hey, this is what all their orders are right now, and this is what you're moving forward with as far as orders. And that's where we go with that. I think we have Megan next, and then we'll finish up with questions.
Good morning. Can everybody hear me? Okay. I am Megan. I am from Recreation or Activities. And I will show you a little bit about what recreation looks like on skilled care. So some of the things that we offer are physical, cognitive, emotional, spiritual, social. I will say when you're on therapy, you're probably not having a ton of time for recreation. Javier kind of takes up a lot of your time, and you need time to rest. You need time for visitors. You need time to just breathe. So we understand that. So when you come to us, we're going to assess you. We're going to go through a small assessment, find out things you like to do. Some people like to stay busy while they're there and don't have too much therapy going on. So we are there to provide activities for you. You have access to activities throughout our facility. You can still go to independent living activities if you're cleared to go there by yourself. But we do have all these programs available for you if you want to attend. We have puzzles. We have a library cart. I'll bring a snack cart down the hall. Bingo. Anything you can imagine, we try to provide for you. The harpist does make rounds up there. Susan, I'm sure most of y'all are familiar with Susan Carroll. We have a pet therapist that comes through to bring dogs by. Yes, we have adult coloring books. Tia and Kiana are really good about providing like magazines. They're always available. Books are available. I can go grab a book from Independent Living for you if you want that. But we do assess in the beginning and then kind of go from there and see what you want to do with us. This is an example of a weekly that you'll receive. I deliver them every Monday morning, usually by 9, and I'll put that in your room so you can see what activities we have going on for the week. There's also a monthly calendar on the unit that is available at all times right across the nurse's desk, so you can see what's going on a more long-term basis. The chaplain makes rounds up there. But yeah, this is just an example. We have lunch-ins that you're able to sign up for, brain games, bingo, socials, our Halloween party. People from rehab came down to join us. Lots of stuff to offer. Do y'all have any questions for recreation? So some are combined, some are not. The weekly that I give you is going to be assisted living. Just it's closer in proximity. So you'll just go down to floors 3, 4, and 5 to attend activities. And then if we have a bigger group, that's what's on the mezzanine. And that's usually combined with all of our areas: healthcare, memory support, and assisted living. Yes. Is adult coloring risque? No, we try to keep it not risque. Good question. Good question. Do you have any other questions for recreation? All right. Thank you.
All right. Any other questions at all? Yes, ma'am. Yeah, so most of the people that are coming to the cafe, they have family and stuff bringing them. They can do a meal swap, that they just have to tell at the register who they are and where they're coming from, and there's like a meal swap that they can do that pretty much takes, as long as they're just getting a normal meal and not getting, like a filet and lobster or anything, they can do a meal swap. So yeah. Perfect. I'm glad. He knows. He was just, and anyone didn't hear that. He said that when you do the meal swap, they will credit $8 back to your meal budget. I didn't know that exact number, so great. Any other questions? Yes, ma'am. No. So that you have to have a 3-night stay to be able to get your short-term rehab through the skilled. And that they waived that during COVID. That was something that was like a waiver where they were just trying to get people back out of the hospital, and that waiver is gone. So you do have to have the 3-night stay. But most of the time now, if you're the older, a little bit older population, they do know, and they're trying to keep you guys if they know you need to come to skilled rehab. Now, there are people that will go have a knee replacement. I know one of you guys, I don't know if you're in here now, had a knee replacement not long ago and went back to independent living. So she wouldn't necessarily have had to stay the 3 nights if she didn't need to. But to get that Medicare, it has to be a 3-night stay. Yeah. So when you're here for when you're there for skilled care and you've had your 3-night stay, we're paying for everything. If you have an outpatient thing, then it is my understanding that it's based, if you're just coming over and you didn't have your 3 nights in the hospital, it is my understanding that you're going to pay your room rate based on your current plan that you guys have with Melinda. Is there, he asked if there was any rationale for the 3-day stay, and there's not a lot of rationale for a lot of things the government does. I wish I did know. I truly don't. I was hoping that with the COVID waiver that they may try and keep that waiver, like, you know, make it a change, but they didn't. They took it away, and to me it was saving the hospital money and getting people out quicker, but they took it away, so I'm really not 100% sure on that. Yes, he said. Yes. Absolutely. And he said that you have to make sure that you're not listed as in observation for one of your 3 nights in the hospital. And Lindsay does really good at checking with the hospital before you come. If they say you're coming for Medicare, we're like, hold on, these notes say that they may have not been in observation, you know, before midnight. So, you know, we do try and look at that as well. All right. No other questions? It's good to see y'all. I hope y'all don't have to come over, but, you know, if you have to, it's fun. Oh, yes, sir. Absolutely. Absolutely. You know, firsthand experience right there. That's always good. Don't let him say anything bad about us, though. Yep, exactly right. Yes, ma'am. Yes, ma'am. What the hospital sends us is what we have, so that's what we have to go by. She was just saying, Yes. She was saying make sure your medicine is correct when you're at the hospital because that's what the list we get. That's really all we have to go by. Yes, Joyce. It really just depends on the situation. If they can, they will, but there are 20 other patients on the floor, so we try and encourage you to have a friend come and get you or family to bring you down, but we do try and help with that. But you just never really know. There might be a lot going on the floor at that time, and then they'd have to come back and get you. It just depends on the situation, but we do try and accommodate that. So on the 6th floor rehab, which is the floor we're talking about, during the day there's 2 nurses and 3 CNAs. And at nighttime, there's 1 nurse the entire night, and sometimes a second nurse, 7P to 11P, and 2 CNAs. All right, well, I hope y'all have a good day. Happy Friday.